every time, every year in November, when it gets cold, she gets a sinus infection and she always gets an antibiotic. Why don't you want to give me the antibiotic?
We far overprescribe antibiotics when there is no real need to.
Welcome to your daily health briefing. I'm Dr. Albert Takem. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. Dr. Khan, how do you know if your sinus infection really needs an antibiotic?
I love this question. And this is something, we all run into every day. And sometimes, people are mad at us, because they think we're trying to keep away some medications that they need.
Yes.
Specifically antibiotics.
Ration care.
There you go.
You don't want to give me an antibiotic. My previous doctor always gave me an antibiotic.
Yeah, exactly. Or I have this cough. It's the same cough I always have. I need this medication right now,
Yes. Every year in November, I get the sinus infection, and my doctor always gives me an antibiotic.
Exactly.
So I say that because I actually have a patient who gave me a call, and she was very mad, and because I wouldn't give her a prescription for an antibiotic. And she had the classic symptoms of what we know as a sinusitis, right? As part of a common cold, runny nose, facial pain, feeling miserable and congestion. And she told me, classic, that every year in November, when it gets cold, she gets a sinus infection and she always gets an antibiotic. Why don't you want to give me the antibiotic? Why is that a problem, Dr. Ken? What does the science say?
What we've seen is that we far overprescribe antibiotics when there is no real need to. So this sort of also you have to take a step back and you have to look at when the patient comes, is like, hey, what am I treating, right? What are the chances that this is bacterial? What are the chances that this is a viral infection? And so, as we know, and sometimes I do teach my patients this as well, is that the difference between bacteria and viruses is that a bacteria is a living organism. Viruses are sort of classified in a different category. They're nor living nor proper organisms.
They require a host cell.
They require a host cell to function, to multiply. The basic facts is that antibiotics don't do a single thing for viruses, all right? So you cannot treat a viral infection with any kind of antibiotic. It is fruitless. You're just gonna get side effects. So when people commonly come in with the sinus congestion symptoms, there's also, is this an infection? Is this sinusitis? Or is this sinus congestion? And many times you can have all the symptoms, but not have an infection, and so the treatment is more so than supportive. Your saline flushes, your Flonase, your antihistamines, and time. And so
a cup of hot tea.
A cup of hot tea,
warm
and
blanket.
a hot shower, exactly. And so, sometimes there's also what they call like a bias, where sometimes when people are taking a medication, your brain is a very powerful tool. So you start feeling better as soon as I give you an antibiotic, but it could have been a water pill. I could have given you a placebo, but you still start feeling better, Realistically, also what happens is patients come in, it's already been 3 days, 4 days, a week, I've had these symptoms already. I need the antibiotics right now. They start taking the antibiotics 5 days in or whatever. The course of the disease itself is about a week to 10 days.
They were already going to feel fine.
Yeah, they're going to start getting better naturally, but because now they're taking antibiotics in the middle of that, they're like, oh, look, the antibiotics fixed me. And so this occurring throughout your lifetime, from childhood onwards, you sort of think, oh, I need these antibiotics for this to work, It
always gets better with the antibiotic. And another question another statement that patients always make is that, I've been fighting this for 7 days now. I think I just need an antibiotic now to knock this out. But to your point, by day 7 or 10, it gets better on its own.
Exactly.
So now you're taking an antibiotic for no reason.
Yeah. When you were saying, and that's a very common example, I've seen it multiple times myself, I always get this infection this time of year. Mm-hmm. So, you know, people who have actual recurrent sinus infections, right? Mm-hmm. You're talking 5, 6, 7, sinus infections per year. So like every month, every couple of months, you're having an infection. And that population of patients, a lot of times there's a reason why they're getting multiple sinus infections. Things like deviated nasal septums, things like polyps in the back of the nose, the airflow is not correct, allergies, and they're congested chronically, and so when the season changes, even the slightest amount of something throws them off edge and they get all the symptoms. And so sometimes where you have patients that are having multiple issues, infections or symptoms multiple times throughout the year, that might be something you might want to evaluate further, maybe an ENT, get a nasal scope done, sort of see what's going on in here, that's sort of causing this. For people who get it about once a year, that's not classified as a recurrent sinus infection. And a lot of times when the seasons change, it's very common to have these symptoms, especially in our DMV area.
What are the dangers of overprescribing antibiotics? Like when a patient says, I want an antibiotic because I get the sinus infection. And the patient feels like the doctor doesn't care. The doctor is not hearing me. What is the doctor thinking? How is the doctor protecting this patient, even when the patient doesn't think the doctor is helping them?
Great question. So number one, I'll start with is going to be antibiotic resistance. If you travel to certain parts of the world, there's countries you can go and you can get any antibiotic that you can imagine from a pharmacy. No prescription, no nothing, you just pay for it.
From the street?
Yeah, just from the street. And so when bacterias, when they see an antibiotic too much, they're smart too. They figure out a defense mechanism. So if you start using antibiotics unnecessarily, the bacteria are going to start to defend themselves against this antibiotic, whereas now this antibiotic is sort of useless. The bacteria has outsmarted it now. It doesn't work on it anymore. So the more you use an antibiotic, especially in situations where it's not really needed, you're playing into this antibiotic resistance.
So
issue.
Antibiotic resistance is like the boy who cried wolf.
Yeah.
You take it, bacteria becomes resistant to it, and when you actually need it doesn't work.
Exactly. And so that's how you end up with multi-drug resistant bacteria that we see in the hospital,
Which means you might have a pneumonia, and now it
you
will
need
not
a special medication.
azithromycin, to doxycycline, common, and then you might need a special medication.
Exactly.
Now.
They're much more expensive. You have to be in the hospital for them, and they're not fun.
And get it IV.
Exactly.
And the like.
Yeah.
Okay. And the other thing we didn't mention is something like C. diff colitis.
Exactly. So that was going to be my next point. So and I'll get to C. diff right after this, even more commonly than C. diff, a lot of times when you take antibiotics and you don't really need them, you'll end up getting diarrhea, because again, your GI, your gut, your body lives in a balance. Inside of your gut, there's what we call good bacteria and then quote unquote bad bacteria, but they have a biome, environment that they live in, and your body, you sort of need both of them. So now if you throw in an antibiotic, especially one that you didn't really need, and you throw this balance off, well, diarrhea is a very common side effect from that. So that's why diarrhea is a very common side effect for all antibiotics in general, The other thing that you see all the time in primary care would be, unfortunately, our female friends, where, they're going to be more prone to getting yeast infections or vaginal infections, because again, same idea, there's a balance of pH vaginally that the antibiotics can throw off, and now you have an infection there. Now you need another antifungal to treat that, And these two, like GI symptoms or yeast infections, vaginal infections, are very common post antibiotic use. And then lastly, to your point of C. difficile, for our audience who doesn't know what that is that that's a very dangerous bacteria that you can get if you excessively use antibiotics. And then certain antibiotics are more so associated with getting the C. diff infection. And to summarize a C. diff infection, you're going to be having diarrhea, large, voluminous diarrhea about 30 times a day.
False belly.
30 times a day. Yeah. And that is not fun. And then guess what? You need another antibiotic for another month to fix that issue. All because you had sinus congestion. And I've had patients like that.
Yes, I think both of us have had patients who wound up in exactly that situation. So let's help out the patient here. As I always say, we are the patient's allies here. So we're not trying to send the message that we refuse, we don't give you antibiotics at any cost.
Absolutely not, yeah.
we are trying to help the patient navigate this complex issue of respiratory illness. So let's distinguish for the patient, how can the patient know that they're dealing with a virus versus a bacterial infection?
I got you. So a lot of times, especially when we're focusing a lot more on the sinus, so especially in these kinds of situations, when it's a bacterial infection, you're going to be seeing a lot of thick, green, gunky sort of discharge coming out from your nose, you know? Not so much it's stuffy, or not so much it's just clear white stuff coming out, or maybe even some yellow stuff, but like you're getting this more thick, yellow, gunky, purulent stuff.
And that tends to happen like after 10 days.
Yeah.
When initially you probably had like a clear nasal drainage.
And it got much worse.
Then you got congestion.
And your infection is getting worse, So you're having that. So, and then on top of that, now fever. Now fever is a very important part too, where especially in a sort of a sinus infection situation, fever is sort of one of those criteria that you look at to see if this is going to be more so bacterial than or viral, you know.
And another thing I always tell patients that there is an initial period of improvement with the viral infection. You get better, and then the bacterial symptoms, bacterial infection symptoms you just mentioned will start. So it takes about 10 to 14 days.
Yeah, and that's very common. I think the other issue is also sometimes, you know, people just don't have the patience for it, because again, you have to go to work. And with COVID and every year now, you need testing and this and that, or you need clearance to get back. You know, I get it. You know.
Yeah, and the patient just says, "Give me an antibiotic."
Just
so
end
we
this
can
now. End my misery.
now.
Yeah, exactly. And so, but you know, again, that's not the correct way of sort of doing it. You know. But when it comes down to it, bacterial or viral, we're doing our best to try to delineate which one it is. If the symptoms are excessive or they're longer lasting, they're not getting better, it's been 2+ weeks, maybe it's time to just try that. If not, I would urge you to try to do all the conventional at-home therapies, because that's the best thing for you.
Okay. So just to recap for the patients and the listeners. So a viral infection generally will last 3 to 5 days. You would have, when it comes to facial pain, you will have pain on both sides, the frontal sinuses, both sides, the maxillary sinuses, and the ethmoidal sinuses on both sides of the face. We also said that it would usually, you might have a runny nose, right? And it's a clear, and you just feel miserable. Then you get better. And then about 10 days after, you might start having, you mentioned, gunky, foul, yellowish or greenish nasal discharge. You would have pain on one side of the face, not both sides, one side of the face. And then you also mentioned the fever and just getting generally sicker. That's when you need an antibiotic. All right. So thank you, Dr. Khan. So I guess we'll add the action items for our listeners that you mentioned. They have to hydrate, rest, that's a warm blanket, watch some TV.
Get some hot tea.
Nasal saline, if it works for you. There are a wide variety of products over the counter. And especially seek care if any of the red flags we mentioned happen. That is when you've transitioned from a viral infection to a bacterial infection. All right. Thanks for your expertise, Dr. Khan. See you next episode. This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Takem, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.